For an MCL injury of the knee, the medial collateral ligament, would peptides or regenerative treatments like PRP or exosomes be useful to help it heal, or would sticking to traditional treatments be enough? I share my perspective in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions that you've left me in the comments to the videos on this channel. And please remember, this is not medical advice. It's meant for general information and educational purposes only, especially when we talk about peptides and regenerative treatments that are considered experimental by the FDA. I'm not pushing them. I'm just giving you information because so many people in these comments ask me about exosomes or peptides, and I do feel it's worth talking about. All right, here's the question. I tore the MCL in my knee 3 weeks ago. I want to play soccer as soon as possible. Are there any peptides or other regenerative injections that can help it heal faster? Very good question. Let me address the MCL part specifically and then get into the regenerative and the peptides. MCL, the medial collateral ligament, is the ligament on the inside or closest to the midline of the body. The vast majority of the time that heals on its own. It's outside of the capsule, has a very good healing rate, except in some unusual circumstances like a multi-ligament knee injury, or if it's pulled out off the tibia, there's certain ones of those that don't heal. But most MCL injuries heal somewhere between 1 to 2 weeks and 4 to 6 weeks, but they typically heal. So a lot of times if you just give it time, maybe a hinged knee brace that allows your knee to flex and extend, but it prevents side-to-side motion, that may be enough. But are there ways to make it maybe heal faster or heal stronger, heal better? And that's where potentially peptides or regenerative treatments, they definitely could. Peptides, in terms of a treatment that you give yourself, something you get prescribed by a physician that's knowledgeable in peptides, prescribed through a legitimate compounding pharmacy, potentially something like a BPC or even maybe thymosin beta-4 or TB500, yes, could be potentially very helpful to speed up the healing of that injury. That'd be something that the patient would give him or herself. I'm not pushing peptides. I know that, again, they're considered experimental. I'm just putting that out there. But again, potentially could be something that could help it heal faster, help you recover faster. PRP, exosomes, as something injected by a doctor into that, again, maybe overkill in the sense that that very likely may go on to heal on its own, but could it help it heal faster, decrease the re-injury rate, which the MCL doesn't have a very high re-injury rate. But yeah, I think regenerative treatments could potentially speed that process back up. Again, they're considered experimental, so that's something you want to talk to your doctor about. Also, they're not typically covered by insurance, so that you're paying out of pocket, and a lot of times a lot of money. So that it gets into a risk benefit, and is it worth the few extra weeks of healing faster to do that? That's a discussion between you and your doctor, and you have to kind of decide what's best. But that would be, the MCL would be an area that potentially those types of treatments could be useful. All right, if you want a copy of my ebook, The Arthritis Solution, although it covers treatments that would potentially be good for a variety of orthopedic injuries and conditions, you can get that absolutely free. Click the link in the description below this video. If you have an orthopedic injury or condition and you want to talk to a surgeon about options other than surgery, other than cortisone shots, you can click the link in the description under this video, fill out the contact form, and schedule an appointment to potentially see me. Also, I'd love to hear about your experience with your injury, whatever it is. You can leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video like I did here. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.